guys, I'm Cassie Cameron, founder of Mind High Club, and here I am with the lovely Mandi Jacobson. She's a clinical psychologist who specialises in mental disorders and also becoming a new mum or dad and adjusting to parenthood. And today we're going to talk about just that. So we all know that becoming a parent is really exciting and awesome,
Yes.
but also comes with its challenges. So, for our audience who are becoming new parents, are there any really helpful tips or things they should really be aware of?
Sure. Well, adjusting to parenthood is an exciting time, but it's also highly emotional.
Yeah.
So what we found is at least 80% of women are going into the baby blues, even
80%?
80%, yeah, about 4 days into after giving birth, just due to hormonal changes. And that just might be a little bit of sensitivity, a little bit emotional, and that generally passes really quickly with just a lot of reassurance and a lot of support.
Yeah.
So there's a lot of challenges that come with being a new parent.
Yeah.
The expectations of what it might be like versus what actually happens. With the birth process, you might have a really tight birth plan and things can go wrong, and we need to be really flexible around that. Whether or not you're breastfeeding, some people might have issues with that. People are getting a range of advice from all different people, doctors and midwives and obstetrician, and everyone might have different training and might have some different advice and different expectations of what will work, which means that we really have to build, learn on the job and build our confidence and understand that it's really trial and error getting to know our own child.
Yeah, right.
Yeah.
Yeah, and also things like, with you in clinic, when you're seeing clients about this issue, what are the main things that tend to pop up for them? What are the most common?
A big thing is actually this big shift in your identity. When you're becoming a new parent, it's a change in your role. So that can sometimes be something we just fall into really nicely, but sometimes that comes with a sense of loss as well. Sense of loss of the things that we were able to do that maybe we really have to work hard to fit in now. So working a lot around self-care with new mums and dads, making sure that although we're giving so much to our new family, we need to make sure that we're giving to ourselves as well.
Yeah, true, so important.
And building our confidence, because when things don't go as we expect, we tend to sometimes beat ourselves up. I'm not coping, I'm a bad mum, I should know how to settle my baby, I don't know what's wrong, and that thought process can spiral into feeling like this is no fun, and then we beat ourselves up for not enjoying it. So that kind of, self-critique and not good enough, I'm not doing this right, is that fairly common? That is really common.
Yeah.
And it can be really useful to have a really open support group. So if you're connected with your community, mother's group or even a dad's group can be really helpful.
Yeah.
If you're being honest and people are sharing their true experiences, you'll find that we're all in this together. And everyone will have their own experience, but it's really important to recognise that everyone will have their own little challenges as well. And that thinking process can be normalised just by talking to somebody else as well.
Totally. So, if someone's going through the same thing, you suddenly feel like, okay, it's not just me.
Exactly. Yeah. And that's a big part of therapy as well. So people I'll see in clinic, we're looking at how the way that we think is going to impact our ability to engage in a vital and meaningful life, engage with our connection with our child, and so we have to recognise the thought patterns that we have that are maybe not realistic, maybe they're a little bit too harsh, and start to work on letting that go as well and adjusting our expectations of ourselves.
Yeah, and so with that being said, when you're seeing your clients, is that something you work on mainly, the thoughts? Are there other things that you do?
Yeah, so thoughts and then just problem solving, a lot of problem solving, maybe involving partners. How can we find time for me to get a nap in? How can we adjust the expectations of myself that I have to get my house tidied, all the washing done, feed, and still get my exercise in. So changing that, yes, perfectionistic maybe mentality, but then also some relaxation strategies too. So I'm big on mindfulness, calm breathing, anything that's going to really help us sort of lower our arousal system when we're starting to stress too much.
Right. New mums and dads, especially when the baby's really young, obviously they're really short of time all the time. So for these quick relaxation techniques, are there any practical tips you can give them to actually fit it in?
Well, you can do some relaxation while you're feeding, Bob. That's a lovely time to relax. And if you're starting to lower your arousal system, your baby's also starting to feel really nice and calm and safe around you, because they're feeding off that signal from you. So if whether you're bottle feeding or you're sort of breastfeeding, if you just take a moment to count your breath, breathe in for the count of 4, out for the count of 4.
And do you hold it at the top, or is it just?
Yeah, I say box breathing. So in for 4, hold for 2, out for 4, hold for 2. And if you do that 10 times, that's enough. And that doesn't take very long.
Right.
Yeah.
You can do that
you can
no
do
matter
that
what you're doing.
No matter what you're doing.
Okay, awesome.
Yeah.
And do you think, also, I'd love to know, are there any other sort of practical tips you've got, making time for yourself, relaxation, the breathing, are there any, I guess, sort of affirmations or other tools in terms of mindset they could apply?
Yes, mindset, this moment will pass. So our babies are going to go through so many different stages of development and changes, and there'll be the nights where they're not sleeping, and that can last for a long period of time. They'll be when they start moving around and you have to chase after them. Every moment is going to come with a different challenge, but it always passes.
Yeah. And
sometimes we get in this headspace, this is going to be my life forever. Yeah.
Right.
But the joy does come. Yeah. So we're reminding ourselves that this moment will pass, and we're looking for those beautiful treasures, and let's not forget them. Yeah, let's make sure that we're each day looking for those small little reminders of what is joyful in the day.
Yeah, that's so true. And in terms of the challenges, for mums and dads or men and women, what is the key differences? Do they experience sort of different things, but have you noticed any key patterns?
Well, some similarities might be just our confidence with a new child. So if we haven't been exposed to young babies, men and women might be struggling with knowing, is this normal for what a baby does, and am I doing the right thing? And sometimes dads really don't, if they are going back to work really soon, they don't get the opportunity to build up the confidence of what it's really like to connect with the child. Both mums and dads might have this expectation that they should fall in love with this child straight away, and that does happen, but sometimes that connection, that attachment really needs to be nurtured, and dads can feel pretty disheartened if they're not feeling that attachment straight away. They might be doubting themselves as well.
Yeah, but it's okay, as you said, everyone has a different experience.
Everybody has a different experience.
Yeah, exactly.
Yeah, and it will take time if you just keep on working at it.
Yeah, I think a lot of people would find comfort in that, if they can definitely relate to others, as you said, speaking to each other about what they're going through. And yeah, that's awesome. I mean, the last question I'd have is for mums experiencing postnatal anxiety or depression that we're talking about, well, first of all, what are some really helpful tips and what can they do about it? And then also, when is it best to sort of self-manage that versus actually seek professional help, do you think?
Sure. Well, know the warning signs, because it is really difficult in the time after giving birth to know the difference between what's just exhaustion, there's changes in our appetites, and there will be hormonal changes that can make us a little bit labile with our mood. So we really need to understand that if we're not finding joy, if a rest is not helping us get back to our usual self, and it's, you know, it's persisting, we can't really find joy in things that we generally used to have that make us happy. It's important that we talk to someone, and that might be our GP, that might be a midwife at our community early childhood centre, just to let them know that we're struggling, we're finding this quite difficult. And they'll be able to do a bit of a screen and assess where we're at, and they can decide on what the best course of treatment might be.
Yeah, cool. So it's sort of more, if you feel like it's just persistent, it's not a couple of days, it's really ongoing and getting worse, say, then that's when you should do that. But yeah, certainly, as you said, that blows my mind, it's 80% of
baby blues.
Baby blues.
So that is different to postnatal depression.
Okay.
So baby blues, we can expect, that's when our milk is coming in.
Yeah.
You know, there's a lot of hormonal shifts there, but so that will pass in a few days. Yeah. Postnatal depression and anxiety is the experience of an anxiety or depressive condition in the first 12 months after giving birth.
Yeah. Right.
And that affects 1 in 7 mums. Yeah. And 1 in 10 dads.
Right.
Yeah.
Yeah. Wow. And for the dads as well, do you have any tips for the dads?
Make sure you're checking in as well. Sometimes dads might feel like they don't have a right to feel this emotion, that, you know, they have to be there to look after mum. But maybe just between, you know, partners, have a little bit of a code. You know, I'm feeling 5 out of 10 today, just so that you're, you know, checking in and really on par with how each other are feeling. And don't feel guilty about maintaining some of your activities that are really important to you. Be flexible around it, but try get out, try do some exercise, really look after yourself.
Yeah, awesome. Well, thanks so much. Really awesome tips. Good to hear from you.
Thanks, Cassie.
Yeah. There you have it, guys. All the tips from clinical psychologist Mandi about how to adjust to parenthood as a new mum or dad. Thanks.